And every year we've had a call to action regarding organ donation in North Carolina, and this year is no different. To take you back just a few short years ago, we had a piece of legislation that I authored that passed unanimously in the House and the Senate called the Heart Prevails, which we're pleased to report in the first year of its existence resulted in a 50% increase in corneal transplants in North Carolina. And every year since then, we've been recognizing National Organ Donation Awareness Month. And last year, we had a stretch goal because we were about 25,000 registrants from having our 4 millionth organ donor in North Carolina. We hit that goal last April with our call to action, and this year our call to action is to promote the Donate Life license plate. This was the result of a lot of hard work by Representative Mitch Gillespie and others to make sure that this actually came into being. So with that, I want to say thank you for all that have come today, and I'd like to introduce Sharon Hirsch from Donate Life to give you a little example of what this new license plate will mean and why we need 300 people today to go on the Donate Life website and secure their Donate Life license tag. Sharon.
Thank you. Good afternoon. I'm Sharon Hirsch. I'm the Executive Director of Donate Life North Carolina. As Representative Folwell said, we are promoting the license plate, which is shown down here. We need 300 applications from across the state in order to begin production. We're very excited about this. It's going to benefit Donate Life North Carolina's outreach efforts, as well as supporting recipients and donor families at our state's 5 transplant centers. So we strongly encourage folks to get those applications on our website at donatelifenc.org and to download the application, fill it out, and send it back in as soon as possible. Our goal is to reach that 300 application level by April 30th. I also want to talk to you today about Donate Life Month, which is April. Our organization works in partnership with Carolina Donor Services, LifeShare the Carolinas, and the North Carolina Eye Bank to encourage and inspire folks to become organ donors by registering at the DMV or at our website. 2012 is a really important milestone year for us. Just this past fall, nationwide, we hit a big milestone. 100 million registered donors were achieved across the country. So we've set a new goal, and we've done it in conjunction with Donate Life America. We're going to try to register 20 million new donors across the country in 2012. And we're using social media like Facebook to share stories of hope. And we're having events, particularly in April, to celebrate Donate Life Month. And one of our big ones will be April 20th, will be Donate Life Wear Blue and Green Day. So we hope many folks will get involved with that. Currently, North Carolina boasts the 6th largest registry in the country, and the Heart Prevails legislation is a big reason why we've hit that milestone. We provide educational materials at DMV offices and curriculum materials for driver's ed classrooms across the state so that folks can make a decision when they go to the DMV and the examiner asks them, do you want to be an organ donor? Individuals can also register online at any time at donatelifenc.org. Every day, 18 people die because they didn't get a transplant that they needed. Yet one organ and tissue donor can save up to 8 lives and enhance up to 50 people's lives through cornea and tissue donation. Many people have to wait more than 5 years for a transplant. Registering as a donor is an extraordinary gift, and there are many, many North Carolinians alive today because someone like you said yes. And for many donor families, giving the gift of life has enabled them to find solace and purpose during a very difficult time of grief. We have some quick facts that we want folks to know about as they make this decision. You're almost never too old to donate. Despite some notions to the contrary, people that even have poor medical histories can be registered donors. You can let the medical professionals disqualify you should the time come. Medical suitability is determined on a case-by-case basis at the time of death. Even people that have serious health problems like diabetes, high blood pressure, heart disease, or other conditions can still be registered donors. Potential donors are carefully screened prior to transplant to ensure that organs and transplants are safe for the recipients. The doctor's priority is always first and foremost to save your life, whether you're a donor or not. Organ, eye, and tissue recovery takes place only after all efforts to save your life have been exhausted and death has been legally declared. The doctors trying to save your life are separate from the medical team that works to recover and transplant organs and tissues. A national computer system and strict standards are in place to ensure ethical and fair distribution of organs. Organs are matched by blood and tissue typing, organ size, medical urgency, waiting time, and geographical location. An open casket funeral is possible for organ, eye, and tissue donors. Throughout the entire process, the body is treated with care, respect, and dignity. There's also no cost to the donor's family, and it is illegal to buy and sell organs and tissues for transplant in the United States. And finally, all major religions support organ, eye, and tissue donation as an act of charity. Transplantation is one of the most remarkable success stories in the history of medicine, but despite continuing advances in medicine and technology, the need for organs and tissues is vastly greater than the number available for transplantation. We continue to be challenged to meet that demand for transplants. This morning, there were 3,564 candidates on the waiting list in North Carolina for organ transplants. 113,718 candidates are waiting nationwide. Transplantation gives hope to thousands of people with organ failure and provides many with active and renewed lives. We hope you'll be inspired today to make sure that you and your loved ones have a conversation about registering as a donor, and that you'll register today at donatelifenc.org or at your DMV, and that you download that application and get the license plate. Thank you very much.
In closing, before I take questions, just want to touch on three things. We are extremely grateful to our donor families in North Carolina, and we continue to keep them in our prayers, but we additionally recognize that but for the work of the driver's license examiners, the state employees in our DMV offices, the question of would you like to be an organ donor might not get asked, and as a result these lives would be